Dear colleagues, I'm Ko-Ting Chen. It's my great pleasure to be here to present our preliminary results of the combination of NaviFUS system with Bevacizumab in patients with recurrent glioblastoma. There are no standard treatments available for patients with recurrent glioblastoma. Options including re-resection, Bevacizumab, tumor treating field, re-irradiation, chemotherapy, and immunotherapy. The fast BBBO strategy has been proved to be applicable and enhance drug delivery in recurrent GBM patients by different therapeutic ultrasound systems in clinical trials. However, data of combining fast BBBO and Bevacizumab in recurrent GBM patients are lacking. The Bevacizumab is a 150 kilodalton large molecular drug. We have demonstrated a significantly enhanced drug delivery up to 5 to 50-fold in animal models. Besides, a survival benefit was also observed. Based on our recent study, which demonstrates a novel fast device using neural navigation guidance, we were able to precisely open BBB in recurrent GBM patients. In the meantime, a potential immunostimulatory effect by fast BBBO alone was suggested. However, the first generation of fast beam volume was too small to treat patients. Therefore, a second generation of array beam to create larger ROI has been designed. To cope with the fact that over 90% of recurrence in GBM is at the margin of resection cavity, the exposure units are designed to cover the tumor peripheral region as much as possible. To better design the treatment plan, we use 3D printing for treatment rehearsal. To maximize patient safety, we use real-time acoustic-emission feedback control. Like you can see in this video, the orange figure is the emission feedback and the blue figure is the real energy. So we can control it in real time. Here is the protocol. We plan to recruit 10 patients with first recurrence. NaviFUS BBB opening is used within 1 hour after IV infusion of Bevacizumab. The study ends if patients had a second progression or intolerant to fast treatment or a completion of combined treatment up to 38 weeks. The trial is performed in an outpatient setting. Here is the results. First of all, we can see a larger BBB opening up to 2 centimeters at target region. Here. We have now recruited 2 patients. In subject 1, the residual tumor was at right frontal lobe. This is the planned trajectories. On T2 flare imaging, we can see the evolution of T2 high signal in region at fast-treated site versus untreated regions from serial MRIs. What seems interesting to us is that we found the first being treated site here, the right lateral ventricle, indicated by yellow arrow, seems to have less significant increment of T2 signaling comparing to the contralateral site here. An analysis of T2 signal showed a slightly lesser degree of increment in beam-concentrated regions, comparing to contralateral edema progression site. The patient is still in stable disease status, and the progression-free survival is 9+ months. In subject 4, the recurrent tumor was more extensive at left temporal parietal region. The beam path was designed to cover temporal insular regions. When comparing the beam concentrated regions indicated by the yellow arrows to the less exposed region, we can see the red beam concentrated areas had a similar T2 flares increment as contralateral non-tumor region. The red line and the black line. In contrast, the blue area indicated a signal of disease progression here. The patient had a progression-free survival of 4 months. Conclusion: NaviFUS is feasible to combine with Bevacizumab in recurrent GBM patients in an outpatient setting, and to open BBB accurately and repeatedly. A trend of normalizing T2 signal hyperintensity was observed in beam-concentrated region, which might suggest that FUS BBBO has the potential to decrease edema or tumor invasion by the mechanism of enhanced Bevacizumab delivery to the treated site. More data are needed to analyze whether the adding of FUS BBBO plus Bevacizumab provide survival benefit. With that, I would like to thank Professor Wei and Professor Liu and all our team members for their brilliant work and all the funding support. Thank you very much.